I'm Dr. DeShawn Taylor, and I am coming to you live today with a special discussion in honor of Non-Binary People's Day. Going to give a moment for everyone to recognize that we are live on Facebook, Instagram, and YouTube today. I hope everyone's having a great day. So I am Dr. DeShawn Taylor. I am a board-certified gynecologist and family planning specialist, and I provide gender-affirming care for transmasculine and transfeminine individuals in my clinic. And so in celebration of Non-Binary Awareness Week, and specifically Non-Binary People's Day today, I want to uplift the lived experiences of non-binary folks. According to a survey recently released by the Williams Institute School of Law, 1.2 million LGBTQ people identify as non-binary. And you know, our society tends to recognize just two genders, male and female. And the idea that there are only two genders is sometimes called a gender binary. Binary meaning two parts, so male and female. Therefore, non-binary is one term people use to describe genders that don't fall into one of these two categories, male or female. Most people, including most transgender people, are either male or female, but some people don't neatly fit into the categories of man or woman or male or female. For example, some people have a gender that blends elements of being a man or woman, or a gender that is different than either male or female. And some people don't identify as any gender at all. Some people's gender changes over time. And so people whose gender is not male or female use many different terms to describe themselves, with non-binary being one of the most common. My topic for discussion today is gender-affirming hormone therapy, which is the most common medical choice for transgender individuals, non-binary transfeminine individuals, and non-binary transmasculine individuals who want to change their physical characteristics. Now, before I get specifically into the discussion of medications and effects, I'd like to briefly discuss some terms so that we are on the same page. Transmasculine individuals are assigned female at birth. Transfeminine individuals are assigned male at birth. Also, being non-binary is not the same as being intersex. Intersex people have anatomy or genes that don't fit typical definitions of male and female. Most intersex people identify as either men or women. Non-binary people are usually not intersex. Okay, so gender-affirming hormone therapy methods can include pills, injections, pellets, patches, and creams. And the method prescribed depends on your gender affirmation goals and your health history. Choosing gender-affirming hormone therapy is an important life-changing decision. If you're thinking about having this treatment, you should learn everything you can before you begin. You should also know that it may take years of treatment for you to get where you want to be, and that there may be significant health considerations that come with hormone therapy, including possible impact on your fertility. You and your healthcare professional will discuss all potential outcomes before you begin treatment. And once you begin treatment, you will keep regular appointments with your healthcare provider to check changes in your appearance and your health. So your treatment plan includes the types of medications you need, how much of each medication you take, the ways by which the medication enters your body, and how long you are going to be on each medication. And hormone therapy is generally a lifelong thing that you're going to take on to maintain the effects of the medications on your body. Now, each individual responds to hormone therapy differently, and no medical professional can predict exactly how a person will respond. You and your medical provider may need to try a few regimens before settling on a long-term treatment plan. But here are some of the medications that are available to you for the transition. So first, there's testosterone. And this hormone is used to masculinize the body by reducing the effects of estrogen in your body and promoting masculinization by encouraging the development of masculine secondary sex characteristics like facial hair, muscle definition, etc. Estrogens, usually estradiol, are used to feminize the body by encouraging the development of feminine secondary sex characteristics like softer skin and breast growth. They can also decrease the amounts and effects of testosterone in your body. Progesterone is used in conjunction with both testosterone and estrogen. And this is used for birth control and also to further suppress testosterone and complement estrogen's feminizing effects. And so examples of the progesterone is the Nexplanon implant, there's the Depo-Provera shot, there's the hormone releasing IUD, which IUD stands for intrauterine device. Testosterone blockers are used to decrease the amount and or block testosterone's masculizing effects on the body. Some blockers suppress testosterone itself. Some block testosterone receptors so that the testosterone does not have an effect on your body. And then some only block certain kinds of testosterone. And so all of these medications are used in conjunction based on your goals for your gender affirming care. Now, every medical treatment, including hormones, involves risks. With regular blood work and physical exams, we monitor for risks and side effects. And from there, we do our best to keep you healthy while continuing your treatment. Some side effects may be temporary, others may cause permanent harm. So to protect your health, your provider may adjust, pause, or discontinue your treatment to keep you safe. And here are some possible risks and side effects. This is not an exhaustive list. So one risk is lost or reduced fertility. And even after stopping hormone therapy, the ability to make healthy eggs or sperm may not return. Another risk is an unexpected and non-viable pregnancy. Because the effect of fertility is hard to predict, because the effect on your fertility is hard to predict, you and your partner should still use contraceptives like condoms, the birth control implant, the Depo shot, IUDs, etc., if there is a chance that a pregnancy can result from sex. If you menstruate, even if your periods stop, assume you can still get pregnant, and that pregnancy may not be viable, meaning it may end in a miscarriage. If you produce semen, and if your semen changes in consistency, you still may be able to get someone else pregnant. There can be changes in your cardiovascular health. You may experience changes in your cholesterol, blood pressure, clot formation, the number of red blood cells, and other things that could cause increased risk of cardiovascular disease like heart attacks or strokes. While rare, these adverse cardiovascular changes may result in needing additional treatment like blood pressure medications, blood thinners. And severely adverse events like a heart attack may result in disability or death. Another risk is changes to your genitourinary structures and function. So both internal and external organs in the reproductive and urinary systems will likely be affected by hormone replacement therapy. You may be prone to more urinary tract infections, unable to maintain an erection. The menstrual cycle becomes irregular, with including the cessation of menstruation. The testicles can atrophy and much more. So please know that there are ways to mitigate uncomfortable or unwanted side effects in these systems. Changes to cancer risk and continued screening needs are affected by hormone therapy. These vary by treatment and type and still are being studied. But please know that the body parts you have determine the preventive screening measures that you need. So if you develop breasts, you will need to be screened for breast cancer. If you have a cervix, you will need to be screened for cervical cancer. And so as with any medical therapy, there are the wanted benefits and there are some unwanted side effects and some potential dangers. And so that's why it's so important to partner with a healthcare professional to help you reach your gender affirming goals. I provide a new patient clinic here in Phoenix every third Saturday of the month for gender affirming care. And during these visits, we review your medical history, we do some laboratory testing, and we determine your goals for transition. And then I see you every 3 months for the first year to make sure that we get you on track to reach your goals. I really look forward to partnering with you to for your health and wellness. Unfortunately, it's very difficult sometimes for transgender, non-binary people to find safe healthcare spaces. And I want everyone to know that Desert Star Family Planning is a resource for the transgender community here in Phoenix. So to recap, gender affirming hormone therapy can be a very important part of medical transitioning for gender affirming care. Not all transgender or non-binary people want to take hormones, but those who do, this is an important part, along with potentially gender affirming surgery that some people choose to have or not have. I see a question in the chat. So someone asked a question related to osteoporosis with testosterone. Is this true? So the risk of osteoporosis is a reflection of decrease in estrogen. And so when your estrogen levels decrease, whether it's because you're on testosterone therapy or in women who are postmenopausal, bone mineral density becomes a concern, and we do bone mineral density testing when it becomes apparent that is necessary. So some people, based on family history, may be more prone to osteoporosis. And so if that's the case, then we may need to do a baseline bone mineral density scan and then monitor that over time. So that is a potential risk because of the lowering the estrogen levels in your body, but it doesn't automatically mean that you would end up with osteoporosis on testosterone therapy. I hope that helped answer your question. Okay, well, I just want to come on briefly and for my Well Woman Wednesdays with this special discussion because it's Non-Binary People's Day. I hope that you found this information helpful, and if you did, please share and also follow us on our channels on Facebook, Instagram, and YouTube so that you know when we're going live. And again, share with your friends and have a great rest of your day and week.